It affects more than 37 million people each year, making it one of the most common health problems in the United States. Sinusitis.
The symptoms of sinusitis are very similar to those of a common cold. Facial pain or pressure, nasal congestion, and postnasal drainage. Most patients will treat these with over-the-counter agents, decongestants, and so on. If that doesn't work and the symptoms last longer than 10 days, or if they're getting worse after a week, then most physicians will diagnose acute sinusitis and prescribe an antibiotic.
Occasional episodes of sinusitis can be treated medically by your physician. However, when infections become frequent or persistent, antibiotics are less effective and the symptoms can be debilitating. Dr. Michael Armstrong, a sinus and facial plastic surgeon in Richmond, Virginia, has been performing a less invasive procedure for recurrent sinusitis since 2008. It's called balloon sinuplasty.
With functional endoscopic sinus surgery, nasal tissue is cut away to create a larger drainage pathway for the sinuses. With balloon sinuplasty, a balloon is inserted into the opening of the sinuses, inflated, then deflated and removed to create a larger opening for the sinuses to drain. This is often done without removing any tissue at all.
Dr. Armstrong says balloon sinuplasty offers patients significant benefits over more invasive procedures.
Balloon sinuplasty is most commonly performed in the office under local anesthesia. There's no skipping breakfast, no hospital bill, no anesthesia bill. There's very little pain, and I rarely use nasal packing. Most patients return to work within 1 to 2 days, and some have even returned to work the same day.
Balloon sinuplasty provides quick relief to those who suffer with recurrent sinusitis and improves their quality of life.
I've been suffering with sinus problems for the last 15 to 16 years. Couldn't breathe at night, which led me to come here. I had the sinus surgery over a year ago, and it's been a miracle. I've been able to sleep at night. I can breathe freely, and I'm glad I had the surgery.
I had allergies and sinus infections for years that were treated, and then I had the sinuplasty, and it was uncomfortable for a day or two. Feel much better now, and ever since then I've been breathing better, and it's been amazing.
Prior to the procedure, I would suffer from about 6 or 7 sinus infections a year. After the procedure, maybe 1 infection has occurred. Dr. Armstrong performed this procedure in his office under a local anesthetic. The pain was minimal during the procedure and after the procedure. I would say it was comparable to going to the dentist for a teeth cleaning.
I was having trouble breathing, so I made an appointment and saw the ENT. He suggested a balloon sinuplasty. I had the procedure done. It was minimally invasive, hardly any pain, and I was back at work the next day.
Dr. Armstrong trained at Johns Hopkins Medical Institution and is board certified in ear, nose, and throat surgery and also in facial plastic surgery. Dr. Armstrong founded Richmond ENT in 2000 to develop a center of excellence in sinus surgery that strives to advance the standard of care.
Patients with 3 or more sinus infections per year are the ones most likely to benefit from balloon sinuplasty. With the dramatic reduction in postoperative pain and recovery time, we find that many patients are willing to consider balloon sinuplasty sooner than they would consider traditional endoscopic sinus surgery.
I feel like doing more activities. I'm a basketball and football coach, so having sinus problems from year to year and from month to month, it was really devastating for me, and now I can do those things without suffering with my sinuses.
We try to provide a comprehensive approach to the nose. After our examination, we may use an endoscope to look in the back of the nose for anatomy and sinus drainage. We can do a CT scan in the office. We can even do allergy testing in the office. Once we get all the information together, then we can come up with a diagnosis and treatment plan.
Approximately 5 minutes ago, Dr. Armstrong just finished doing a balloon sinus dilation, and I felt immediate relief in my sinuses. The pressure was not as bad. The headache has subsided substantially, and I just think I could go out and go shopping and have lunch right now. It's wonderful.
Less invasive than conventional sinus surgery, balloon sinuplasty can usually be performed in the doctor's office and allows patients to quickly return to normal activities. To learn more about balloon sinuplasty, call today or visit these websites.